Good morning, it's Dr. Scott from Chiropractic Associates in Illinois, and I wanted to talk to you a little bit today about infectious disease. And some people might say, why on earth are you talking about infectious disease in the chiropractic office? Well, from a more holistic standpoint, chiropractors have been addressing infectious disease in a little different manner than you might expect at the medical office. And there are advantages to adding a more holistic type of approach to infectious disease than you might understand. And so I want to take a minute and kind of describe some of these concepts so that you might have a greater understanding and consequently might have a better opportunity to cooperatively treat infectious disease with holistic ideals and have obviously a better outcome. So treating infectious disease, you've got to understand that infectious diseases are caused by bacteria and viruses and parasites and protozoa and microbes. So these are going to be foreign substances that then cause an immune reaction in our body and various vectors of infection. Obviously, we're all familiar with what's happening with COVID and the ability for COVID to infect us through the upper respiratory tract. And so when we have an infectious disease, we've got some choices. We can do pharmaceutical care, or we can improve our defense, or a more holistic approach. It's interesting because when COVID first happened several years ago, Lancet, a medical journal, Lancet, realized that at that moment we didn't have any pharmaceuticals that were particularly sensitive for treating COVID viral infection. And so Lancet was very bold in saying the best thing to do was to improve one's defense. So get the populace, get the civilization to improve their immune function and improve their defenses so that that virus would be less impactful on the system. So let's kind of compare and contrast a little bit. When you have an infectious disease, it's important pharmaceutically that we identify the microbe. So we identify the bug. We need a target. And the reason being is pharmaceuticals choose to isolate the target and then isolate the certain bacteria that we're going to target using that medication. And the goal is to, in essence, kill the microbe or kill the foreign invader. The problem with killing the foreign invader is a lot of times there's collateral damage. So you're going to damage the mucosal wall of your nose, or you're going to damage the inside of the intestinal tract, or you're going to damage the inside of your arteries and veins because these particular pharmaceuticals can be toxic to those areas. So sometimes we've got to deal with collateral damage. The problem is that eventually the microbe changes, particularly viruses, and then you have some mycoplasmas and so on that don't have a cell wall, so they're not resistant to, they're resistant rather to certain medications. And so when the microbe changes, you then get resistance. So we're seeing drug resistance develop. And so then we've got to change our killing approach. So we've got to then tinker with our medication again to find the target. So the difficulty here is it's a moving target. We're always trying to hit the target, but then once we do, we hit the target, the target changes, it moves, it alters, and so we have some problems with that, and then we get long-standing, recurrent infections. In contrast, if we improve our defense, we want to strengthen the barriers. So we want the mucosal linings in our nose to be a place where viruses and bacteria die. We want the upper respiratory tract, places for the viruses and so on to die. Our intestinal tract, we want those barriers to be working correctly so that the virus can never get in there in the first place. And there's lots of things nutritionally that we can do to support that. So we want to promote barrier defense. We want to promote the pH. A lot of these viruses and bacteria cannot live in particular pHs. Normal pH in our body, vaginal tract, things like that, have a particular pH that is very difficult for a virus in which to live. So we want to provide the normal environment for the good bacteria in our bodies, if you will. And we want to be sure that enzymes are working really well, because enzymes are what our natural defense is going to use to kill those viruses and bacteria. All of this is meant to support the microbe killing ability of our immune system. So through the creation of antibodies and then eventually T memory cells, we want our army, if you will, to really be strong against the invading army of bacteria, viruses, which we might encounter. So we want to strengthen the immunoglobulin response. We want to improve antibody response. And we want to mount what we call a broad spectrum defense. When our body is first exposed to a virus, it identifies the virus, and then it creates a broad spectrum. So as that virus changes, the body still recognizes, its immunoglobulin still recognizes that it's a relative of the initial virus via T memory cells, and then can kill it again. And so broad, long-term immunity. And we do that by activating and improving T memory cell activity. So people say, well, gosh, how do we do that? Nutritionally, how do we do that? Functionally, how do we do that? One of the best ways and easiest ways to do that is through clinical nutrition. And Biotics is a company that I've worked with for a long time, has created this product rather, Biotics Immune Support Packs. This is loaded with a lot of the vitamins, minerals, herbals, as well as other products that are meant to improve your immune function, that are meant to improve your ability of the immunoglobulins, the T memory cells, to improve the enzymatic activity and to strengthen your barriers. And this is a nice, easy way. It's all contained in a simple little package. You just take those daily, and that's going to improve your defense. And so in the grand scheme of things, if we want to do the best job, we need a strong defense so that hopefully we never get infected with one of these viruses or bacteria. And if push comes to shove, then we need a really strong offense as far as pharmaceutical intervention goes. But the goal should be to never get infected in the first place. So mounting a really great defense. I hope this helps you understand a little bit the differences between pharmaceutical care for infectious disease and then a more holistic approach to treating infectious disease. And if you'd like some more information about the Biotics Immune Packs, of course, let us know. My name is Dr. Scott in Chiropractic Associates, and if you're having a problem in this arena or like some additional assistance, please contact us. We'd be happy to help.